Hello, my name is Allison Kirkner. I'm a registered nurse and a nurse practitioner, and I'm here today to discuss the current nurse faculty shortage facing America. The role of the nurse is unarguably important. Regardless of setting, be it outpatient, inpatient, in a school system, or even in the home, the nurse performs a variety of crucial tasks. Assessing the patient, administering medications, assisting with activities of daily living such as brushing one's teeth, advocating for the patient. These are all vital, crucial functions that the nurse may perform in any given hour while they're on duty. Our role as a vital part of the healthcare system is rarely debated. Any patient who's ever needed a nurse can tell you. So, what would happen if there weren't enough nurses to go around? If call bells went unanswered, pain wasn't assessed, vital heart medications weren't given, critical education was not provided to a newly diagnosed diabetic patient? Unfortunately, this is a problem that we are already facing here in America, and as I'm going to explain to you, it's only bound to get worse. A common misconception about the nursing shortage is that there's not enough people who are willing to be nurses. This misconception is debunked by the fact that there are 49,000 qualified candidates that are turned down every year from nursing programs. Combined with the current nursing shortage of approximately 200,000 nurses, we face a shortage of 1 million nurses by the year 2025 to care for our loved ones in the hospital, in the primary care setting, and in our homes. 1 million nurses. So, if you're like me, you have to ask yourself, if it's not an issue with there not being enough people who want to be nurses, what exactly is the problem? Unfortunately, these 49,000 potential nursing students are being turned down on a yearly basis because of lack of nursing faculty. State regulations, as well as a desire on behalf of the nursing schools to provide quality, attentive education, maintain a certain number of clinical faculty and teaching faculty at a ratio proportionate to the number of students. For example, in my practicing state here in North Carolina, the law states that there must be one clinical faculty member for every 10 students. Most schools dictate an even smaller ratio based on their assessment of safety. This requirement and lack of faculty has been one of the largest factors contributing to the overall nursing shortage. So, why is there a faculty shortage, you may ask? Current faculty age, meaning anticipated retirement, as well as workload of the faculty contribute to this shortage. However, the most highly cited issue by current and potential faculty is all about their compensation. Compared to comparably educated faculty in other fields, nursing faculty make only 76% of what their peers make. Furthermore, a master's or doctorally prepared nurse can make anywhere from 12 to 33% more actually in the field versus training others to go into that field. The concept that nursing faculty must completely leave their field to teach is a concept that many who want to teach have difficulty with. Nursing, above many other fields, requires contemporary knowledge of an ever-changing field with ever-changing technology. The nursing faculty shortage is not a new problem. In fact, it's not even close. So, what have we been doing to attempt to head this issue off at a pass? Title 8 of the Public Health Service Act helped to establish a Health Resources and Service Administration, or HRSA, loan program. Aptly named the Nurse Faculty Loan Program, it is designed to assist master's and doctorate students with loan repayment, given that they take specific education classes and are willing to commit to full-time faculty position after graduation. Additionally, the establishment of doctoral programs such as the Doctorate of Nursing Practice was hoped to prepare more doctoral faculty that otherwise would not have pursued a doctorate like a PhD. So these solutions sound encouraging, but as we can see from the data, there's not nearly enough that's being done. So what more can we and should we be doing? A few things. Number one, we need to increase the amount of the HRSA Nurse Faculty Loan Program. The funds used by this program, while increasing eventual obligation as a faculty member after graduation, are sparse. The loan touts up to 85% loan forgiveness if one is chosen for the program, but many who apply to this loan are not accepted. More applicants are willing to go into teaching. More applicants are willing to go into teaching, but without financial incentive, they're choosing to bypass this field. In the fiscal year 2010, only 125 awards for the HRSA program were given, and only 98 were given out in the year 2011 at a cost of $25 million. As a point of comparison, the federal budget this year, and for this year and for the next 5, dedicates $1 billion for the establishment of a high-speed rail. Certainly a noble cause, but nursing is also in desperate need of an increase in comparable funds. We also need to expand Title VIII and HRSA funding. We need to include not only those who are willing to become full-time faculty in this loan program, but also those who are willing to teach part-time with proportionate loan forgiveness compensation. This would encourage those who are not willing to entirely leave their field to start teaching and would potentially lead to their conversion to full-time faculty. Furthermore, for potential faculty, we could allow the education classes that are typically required before the loan can be taken to be instead taken during their first 2 years of employment as faculty. We need to redirect and expand current Medicare funds currently used for nursing education to graduate education. In the past, it was established that hundreds of millions of dollars of allotted Medicare funds would be used to fund nursing education. However, these funds were used and currently are used exclusively for diploma programs, which now make up only 4 to 5% of registered nurse training. The Medicare Graduate Nurse Education Demonstration Program was passed in 2010 and helped to expand funding for graduate programs. However, much of the money from Medicare still goes towards funding a very small percentage of registered nursing training. Additionally, the expansion of funds from Medicare for nursing brought the total monetary support of nursing programs to approximately $200 million. In comparison, approximately $12 billion is yearly sent from Medicare to hospitals for physician training. Medicare is sending $200 million to hospitals for nursing training and $12 billion for physician training. Training our medical doctors is obviously very important to our government. Training nurses and nursing faculty should be as well. It will cost money to increase nursing faculty. It will take money from hospitals, from schools of nursing, from patients, and from taxpayers. During this era of financial crisis, I have no doubt that this is not an appealing idea. However, with projections of nursing shortages reaching up to $1 million by 2025, we cannot sit idly by. We cannot afford to not take creative, lasting steps to increase our nursing faculty and thereby increase our number of nurses in the workforce. Thank you so much for your time and consideration. I hope that you'll take the time to appreciate the role of nurses in our society and imagine the impact it will have when we simply don't have enough to go around.